Pharmacy, pharmacy aide, pharmacy technician, pharmacist, pharmacy specialty areas, and additional career opportunities. Chapter 18.1 deals with pharmacy jobs, different things you can learn in different careers, as well as general information about the pharmacy in 18-2. All right, for a pharmacy aide, what are some of the job responsibilities? Real quick, establish, maintain patient files, prepare insurance claim forms, stock and take inventory of prescription medications and over-the-counter medications. Do you see fill prescription, handle narcotic, or controlled substances anywhere under a pharmacy aide? No. Is a pharmacy aide necessarily certified or licensed like a pharmacy tech or a pharmacist? No. No. They're just a minimum wage, $7.25 an hour person who basically cleans up the pharmacy, cleans up everything, has limited access to all the special medications that we have. Now, once we start talking about pharmacy tech, in just a couple of minutes, we'll talk about the different things that we can do. If a pharmacy aide only needs a high school diploma and just a little on-the-job training. Now, with a pharmacy technician, they can work in a hospital, retail pharmacy. They work under the direct supervision of a pharmacist who is preparing and filling the medications. Do they get to touch prescription medications, narcotics, and things that are controlled substances? They have a certification. Do you think they get to do that? Yeah, a lot of times they will fill the prescriptions, hand it off to the pharmacist. The pharmacist checks this, because who is ultimately responsible for the correctness of your prescription? Is it the pharmacy tech?
Yes.
Is it?
No.
Who is it?
It's not. A physical therapy. No. It's not that either. Correction is a doctor.
The pharmacist. This is filling your prescriptions, not giving you your prescriptions.
Billing?
Let's talk about pharmacy technician a little bit longer. Job responsibilities. They can receive the written prescriptions. How many of your doctors now call in your prescription over the phone or use a computerized e-system? My Physicians Health Group, they have a computerized e-system. They just type it in, boom, it goes through. It gives the pharmacy their DEA number, all the other pertinent information, and you can get your prescription filled that way. Okay? Pretty cool. Pharmacy techs are going to verify the accurateness and completeness of the prescription information. They're going to retrieve, count, pour, weigh, measures, and sometimes mix the medication. They're going to prepare the label and all the other labels, like it says, may cause drowsiness, so be careful when operating machinery, those type of things. They select the type of container, and they affix the prescription and all the labels to the container. Some of the other things the pharmacy tech will do: answer the phone, perform clerical duties, refer any specific questions to the pharmacist, because who's the ultimate responsibility in a pharmacy? Pharmacist, correct. They'll complete some medical claim forms, billing company information. Oh, here's a good one. Prepare intravenous medication. Medication we're going to give you by IV. Now, if we're mixing up solutions or we're going to stick into your veins and ultimately go through your cardiovascular system, do you want somebody who is very good at what they do preparing that stuff for you? Definitely. Establish, maintain patient profiles, take inventory of other over-the-counter medications and other prescription drugs, order medications, and maintain equipment. Those are all things that a pharmacy tech is going to do. Pharmacist. Here we go. Must have a bachelor's degree from a regular college. Then they have to go to pharmacy school. They get a doctor of pharmacy, or the degree is called PharmD, the letter D. To be a registered pharmacy, they must pass pharmacy boards. Each state has its own requirements for whatever certification. Pardon me? It would be similar to a PhD in pharmacy, yeah. Basically, you go 4 years of college, probably in a science area, a hard science area, then 3 years. Up in Amarillo, Texas Tech School of Pharmacy, right? One of my students who graduated about 4 years ago, her parents teach over at the medical school. And any of you all know Mr. and Miss Bullen? Do you know Mr. Bullen or Mrs. Bullen at the junior high school? Yes. Their daughter Jennifer, I just found out last week, one of my former students was accepted to pharmacy school. Pretty cool. Now, what is one of the cool career benefits of being a pharmacy?
Money.
What do you think a starting pharmacist working for CVS, Walgreens, Rite Aid, Walmart, what do you think they're going to make to start off? Starting pay after 7 years of education. $95,000 a year most of the time. I have seen pharmacists. I was working with one up in Borger. He was the only pharmacist in town. He made about $125,000. Is pharmacy pretty good paying career job in the healthcare field? 7 years education. Very similar to nurse practitioners, right? Advanced practice nursing. Very similar to those. Job responsibility. The pharmacist is going to advise the physicians and other health practitioners about what the drugs can do, good and bad. We call those indications and contraindications and side effects. Give them the dosages of the medications. They'll also talk to you as the patient about a new medication, tell you what it might happen, what sort of side effects could happen, what you're looking for it to do. Provide you information about over-the-counter drugs or herbal supplements. Give advice about durable medical equipment. What is durable medical equipment? Anybody got a guess? What is durable that lasts for a long time? Does a wheelchair, an oxygen concentrator, a blood pressure cuff that's automated, one of the tympanic thermometers, all of those things last, right? So they can give you recommendations on those type of durable type products. They complete third-party medical claim forms as well as insurance claim forms. Do you think if you work in a pharmacy you have to have computer skills? Yeah. Especially when you're dealing with insurance claims. If you have insurance. I know one of my medications for my thyroid, without insurance, it's like $179 a month. But with my insurance, I go in and I pay $10 a month for it. Okay? Pretty good deal, huh?
Yeah.
It is. Work locations. Many independent pharmacists own a franchise. It may be owned by a franchise like CVS, Walmart, Walgreens, Rite Aid, those type of things. We have a Health Mart here in Hereford, right? Brent is one of the owners there. Great guy. My students do clinical rotations over there and really enjoy working in that pharmacy because they get them back there and in a 3-week, month period of time doing clinical rotations, give them an opportunity to really think about what pharmacy is, to learn about it, and to see if that's something they might want to go on and study in college, either as a pharmacy tech or as a pharmacist. Now, we talked about pay for a pharmacist. What do you think a pharmacy tech makes starting out? About $16 to $18 an hour up in Amarillo. Not the greatest in the world, but is it better than working at McDonald's? Yeah, quite a bit. Okay. Hospital pharmacies, usually they have a pharmacist on duty 24 hours a day because is the emergency room running 24 hours a day? Do you think they might need medications 24 hours a day? Yeah. They prepare also, like your pharmacy tech, IV medications. They give detailed information to physicians about certain drugs, all the drugs. Are there a lot of drugs out there? Me as a medic, I am comfortable with somewhere around 50 drugs. Cardiac medications, respiratory medications, medications for allergic reactions, drug overdoses, breathing difficulties, and pain medication. How many drugs do you think a pharmacist or a pharmacy tech has to be familiar with? Lots of them, right? Every single year, guess what the pharmacists get brand new? Physician's desk reference. Yeah, oh my God. You want to be a pharmacist? Memorize everything in this book. Or at least have everything in this book. Is this big print or small print? You want to take a look at it?
Small.
Very small print. Is that a big book? And you get this book, the Physician's Desk Reference, every single year.
And you have to learn everything in that.
You have to learn where to get the information. If you're going to be a pharmacist or a pharmacy tech, you're going to have to know a lot of the information on, I would say, thousands of drugs.
What happens if you don't learn all of that?
Then you probably won't pass your state certification for a pharmacy tech or a pharmacist, the state boards. In 10 years, I had one student that wanted to be a pharmacy tech. We ran him through a computer program. I helped him out independently. We got down to the final exam, and he said, Mr. Peters, I don't want to take that test. I don't think I could pass it. I don't know if I could pass it. We're talking thousands of drugs. And what am I familiar with? Maybe about 50. Okay, only about 50 drugs. Pharmaceutical researchers, research and development. How do pharmacy or drug companies make money? How do you think drug companies make money? They overprice, but why do they overprice? Because they developed a new drug they just put on the market and they have a patent for it for 10 years. Nobody else can make the same drug or a generic drug. What happens after 10 years when the patent falls off? Another company will make it. What happens to the price? It drops and we get generic drugs out of that, right? Yes. Sure. Okay. Pharmaceutical researchers usually have a master's or PhD in a hard science like biological or chemical research. The goal is the development or the refinement of new therapies to address unmet medical needs. Have you ever heard of orphan drugs? Drugs that only a few people have the disease. It's not very profitable. Do you think drug companies want to spend a lot of money on research and development for a very small population? No, they want to develop the next best, greatest drug that 10 million people in the United States will have to take and make millions, if not billions of dollars, right? Okay. Pharmaceutical representatives, normally employed by drug companies. They have an associate's or bachelor's degree in the healthcare field. They distribute information about their company to healthcare workers, normally to doctors. They're the ones who take doctors out, play golf with them, take them out to nice fancy dinners, go to doctors' conferences, give them free samples. They may see 10, 15, 20 doctors a day passing out free samples to try to get them to utilize their drugs. Because if you can get one or two doctors at a facility to start using that drug, prescribing it to their patients, what has that pharmaceutical sales rep just done? Made a lot of money for his company and himself, right? Remember, he's a salesman. He is not really a pharmacist. He's selling pharmacy products that are offered by the drug companies. Can someone with a prior record of drug or substance abuse become a pharmacist?
No.
Why? Now, in some healthcare careers, if you have a prior criminal record, they will take into account what the charge was, if you got probation or deferred adjudication, how long it's been, did you fulfill the terms, did you do well with that? But for pharmacy, any type of conviction for any type of drug abuse, substance abuse, your dream of becoming a pharmacist, pharmacy tech, you can throw that out the window. Questions? We're going to have a Schoology quiz here in just a moment over 18.1 about pharmacy techs, pharmacy aides, and pharmacists.